All
Perfect.
right.
All right. Hi, good evening, everyone. My name is Dr. James Fung, and I'm a chiropractor. And tonight, we're going to be talking about synergy in practice, navigating the integrative treatment model. So, thank you so much, Redbird Therapy Center, for allowing me to do this talk tonight and speaking with all of you.
Thank you for being
Um,
here, Dr. James. Would you
yeah,
like me to do a quick introduction
sure.
just to let folks know about you and the lovely work that you're doing? So good evening, folks. Thanks for joining us. I'm Anshul with Redbird Therapy Center, and we are so excited to have Dr. James with us this evening. We're going to be learning a lot about integrative treatment models, especially in the context of private practice. We at Redbird are really passionate about some of the very similar things that Dr. James is passionate about, and especially about, looking at the whole body perspective and looking at creating a really full circle of care for the clients that we work with. A really quick introduction about Dr. Fung. He is the founder of Complete Balance Health Center and is a firm believer in the power of integrative approaches to health. He has over 2 decades of experience in physical rehabilitation care as a chiropractor, and he focuses on helping patients who might be coping with, either concussions or scoliosis. Dr. Fung believes that maximizing the connection between the mind, nutrition, and physical care through personalized strategies is what is essential for long-term wellness and healing. So over to you, Dr. James. Thank you so much once again. And this is going to be an interactive webinar, so feel free to, raise your hand, drop questions in the chat box, and Dr. James will kind of get to answering them along the way. Over to you.
Great. Thank you so much. Hi, everyone. So in the integrative models, and we started the clinic about 2011. Now, I was wondering is that have you really ever wondered how combining nutrition or acupuncture or involving other discipline with traditional psychotherapy? Some of you may have already involved in such practice. Some of you may be involved in a practice that purely just psychotherapy practice only, or could be a solo practitioners. Okay. And if you are in the solo practitioners and or simply or in a group practice setting, but mostly on mental health, then may not be familiar with how combining nutrition or acupuncture or other disciplines may actually transform your practice or patient outcomes in mental health care in general. So in tonight's talk, we hope to look at some of the challenges and opportunities in creating a integrative treatments within the private practice. Share some of my challenges over the years from my own experience, and I don't think there's really necessarily one size fit all kind of solutions or setup. And I think a lot of time it does depends on the that individual clinic, kind of what drives it. Is it primarily start as a mental health wellness center, like from a psychologist or psychotherapist, or is it starting from a nutritional setting from a naturopathic point of view? Or is it from a physical health point of view, like from a chiropractors like myself or physiotherapists, that type of things, right? I think having that will maybe drive it a little bit differently, may look differently as well. Hopefully just share my ideas and my experience, and I'd love to hear some of your experience and your ideas as well, so I can help to learn from each others. So a little bit about myself, and been in practice for almost 25 years now, and started the clinic called Complete Balance Health Center in 2011. And and we're located in South Etobicoke on Lakeshore and Islington area. And in our clinic, we do have myself, physiotherapist, massage therapist, osteopath, acupuncture, naturopath. We also work with psychotherapists and also psychologists too. And really meant to be a integrative care versus a multidisciplinary practice. And I draw a difference between the two because I always feel that in a multidisciplinary practice, you can easily have many people under the same roof, but they don't necessarily talk to each other too much. They may share some patient file, um, but not necessarily of like communications. And prior to Complete Balance Health Centers, before that, we were in a clinic called Absolute Health Clinic. And it was more of a multidisciplinary models where we got 4 or 5 different discipline practitioners together under one roof. Yes, we refer some patients to each other, once in a while, but other than that, we kind of really independent, put individuals, and there's not too much of communication after that. Whereas I see integrative cares, one thing that is really take a little bit more communication effort to communicate with each others, asking questions, meeting, even just to learn from each others. And that's really kind of my concept of how I differentiate a integrative care versus a multidisciplinary practice. And always have this vision that combine the mind, physical, and nutrition components together. So that's why having access or connection with the psychotherapist, psychologist is a really important part of that. And that's why we kind of call it Complete Balance Health Centers since 2011. Now, even running the practice for many years, and I've always noticed that there's challenge in encouraging referral between different category of disciplines, such as from the physical categories like the chiropractor, physiotherapist, or acupuncturist, and trying to have them refer out of that discipline to, let's say, the nutritional component, let's say for nutritionist or naturopath, and also back to, say, the mental health department, the psychologist or psychotherapist. There's always a little bit kind of challenge to push that across and from one category to different categories. I think a lot of time over the years, and from my own experience talking to practitioners been out in the field for many years to student who is still in school right now, is that even though we talk about it, we all know it's important. Everybody's favorite that it's a good idea, but in the school itself, there's not a lot of opportunity to really really make that happen, to actually learn how to refer that to another discipline, right? So that's why when we graduate from school and actually, doing our own practice, we're really not sure how to navigate that. And a lot of time kind of have to self-learn and going through trial errors with that. And even then, even though it's sometimes within our practice and still be challenged to refer within the same category, like, how does the osteopath know how to refer to a chiropractor or when to refer to acupuncturist? And same thing, it's not always taught in school, even though in school we always say, yeah, it's a good idea to have an integrative, we should be integrative, but how to actually make that happen to differentiate the categories or when to make the referral is not always so clear cut. And so what we do in our clinic is that we actually take times on a weekly meeting with some of our newer clinicians, and we have that meeting and we discuss. We may pick a theme, a topic, and we look at challenges of that patients and how we can make that as an integrative care, utilizing different disciplines, right? And because, for example, in physiotherapy, um, nutrition is really not within the scope of practice so much, right? So how are they able to make an interdisciplinary practice or integrative practice when they don't really talk a lot about nutrition? So those type of things. So that's why we find that when you are in a group setting with other different disciplines that work together, the best way to overcome those challenges is actually to have a regular meetings. This either discuss cases or even just to learn from each other. So one thing in our practice, we also encourage the different clinicians to meet with other clinicians, even for 15 minutes, 20 minutes, to talk to each other about what is it that they do, right? We all went to school for 3 or 4 years, and And cumulative, it's not possible to explain all the modality, all these tools that we have in 15 minutes, one sitting. So it always takes time to over that to explain that to people. Now, what's really interesting in mental health care is that the definite surge of that since COVID, right? And the growing demand for mental health care since that time, uh, almost as if the COVID situation could have been a catalyst that kind of expand that really quickly. And so much that, it's become 50% increase in demand for psychological services in last several years, right? So the potential for a better integrative care is even more than ever before. Right, definitely see a lot more clinic popping up, more people graduating from psychotherapy program. So now the more potential to connect with other local practitioners, whether it's naturopath, acupuncturists, nutritionists, locally, or other people come talk to you. So the interaction, the opportunity of that is even much better than ever before, and which is kind of really excited about that. Now, and when we look at this surge of needs for mental health, in about 50% of the last few years, that's very unique for psychotherapy, for mental health. Because if you look at, say, for example, chiropractic, we may see a 6% increase over 3 years um, in the late in 2016 to 2019. Okay, a 6% increase over 3 years. And for example, for naturopath, the utilization rate has been kind of roughly stable the same, only 2% of adults in Ontario. So even though there seems to be a lot more psychotherapists right now, like I guess roughly about over 10,000, I think, believe, or 14,000 when I look at online recently. Um, but there's so much more demand for it, right? So much more utilization rates than ever before. Whereas the acupuncturist or the naturopath is still under 3,000 registrations or registered practitioners in Ontario, as of to date. So definitely a lot of opportunity for the integrative practice with that. Now, so what are some of the challenges that I find? What we find is that with the current educational and practice, there's a gap there, meaning that while the program at school, and this is not just unique with psychotherapy, this kind of really in a lot of different disciplines as well. So, so in psychotherapy, the program don't always adequately showing the students how to integrate or refer to other disciplines, such as nutritionist or naturopathic doctor or utilize acupuncture, that type of things. I know that there is a kind of course on look at general wellness of the person, including lifestyle, etc., but that is very general aspect of it. And second thing we look at is also, your personal belief, right? Your personal experience as a therapist. Have you come across a good experience with an acupuncturist, a naturopath? Your personal experience can influence that hugely. And now we're going to look at really briefly just the research on the integrative practice type of things with others disciplines such as naturopath, nutritions, and absolutely with acupuncturists. And lastly, I think one of the probably most important as well is the networking and collaboration strategies. Since that's not really discussed in school, during the school program, is something kind of left to us to explore that in once we graduate and in the real practice. So same thing over the last 15, 20 years, as we navigate through my own practice, and we always find it challenging of encouraging clinicians to really buy into the integrative practice. Almost everyone that I've interviewed, oh yeah, this sounds really great in theory, but once they join the practice, to have them to really take up the time to be proactive in integrative approach is almost a little bit different story. So let's take a look at the first of all, we look at what I call a training gap, right? Is while we're in school. is that talking to a few of my patients who are actually also in psychotherapy program right now is that even though they do talk about the general wellness of the patients, like the lifestyle changes type of things, but that's kind of really look at minimum um, setting of it and not really in the real practice of how in what cases when you need to refer to other disciplines, such as acupuncturists, for example, right? So if we don't really have that being taught at school, how to do an integrative practice approach in mental health, then obviously when we graduated, it's harder for us to learn how to do that. Is it within my scope of practice? Can I refer out um, to a naturopath or for acupuncture? Am I outside my scope of practice? So these are concerns that people may have. And some of the topic, may not necessarily be included is that how acupuncturists can really help. The neurochemistry of the gut-brain connection is really important. And luckily that in our practice, there's just one thing we really stress. So we actually have counselors in our practice who happen to does both nutrition and counseling at the same time. And she focused on ADHD. So in talking to her, it was really interesting because she's really bring on both role into her own practice, right? So that's why I'm kind of learning from talking to different clinicians, learning what is missing, what the gap is, and how we can kind of fill in that gap. So part of it is the training gap that we see in our training program, not just uh, specific to psychotherapy, but also with other disciplines such as physiotherapists as well. And so that's why, as a result of those lack of training or exposure of opportunities, then we don't really know how to do a very good job with integrative referral to other disciplines. Now, let's see here. If you also look at, I kind of look at the CAMH. I actually work at CAMH when I first graduated many years ago. That they had a program that allow us to go in to set up a user room, set up a shop doing chiropractic, and but that was primarily only for the staff. It wasn't for the patients. But my experience working there is that they were open enough to explore acupuncture as a means for addictions. But even that, if you look at it's not something that hugely, if it's something that acupuncture for addictions is used for a lot of addictions, primarily for weight loss, smoking cessations. Okay. Um, However, in terms of other mental health aspects, it's not widely recognized for some of the more mainstream medical aspects. Yet, the acupuncture is also well known within their own disciplines for depression, anxiety also, right? So one thing is really learning in the training gap is lacking the opportunity how to refer to other disciplines. Now, sometimes we may get a patient asking us a question instead, or asking you questions that is it okay if I try acupuncture for my anxiety? Um, and how about changing my diet will help my mood? Or should I see a naturopath about my sleep problems? So unless you have a good experience or have experience interacting with other disciplines, with naturopath acupuncturists, and your answer to them may be yes, sure, go ahead, try it. It may work, may not work, right? And that's when you really take the time to meet different clinicians in a local area and trying to understand what is it they do, how they can complement your practice. Now, because not all acupuncturists will focus on mental health aspect. And same thing, not all the naturopaths will also focus on mental health aspects. So you really want to try and find someone in your neighborhood of different discipline, but also has a focus on mental health. So this way you're going to be matched with that particular clinician or practitioners to help your patient a lot better. So, I think that's why in our weekly meetings, in our clinic, we always encourage each other's, the clinicians, outside of weekly meetings, is to talk to each other, spend 15 minutes meeting each other's, talk to each other's about their focus, how they can help each other, how can they help the other practitioners, and the other practitioner will be training, let's say the naturopath could be training the physiotherapist what to look for in your patients when they say they're tired, fatigued, but what other questions they can ask so that the physiotherapist patients, so the physiotherapist can pick out symptoms that can be referred to the naturopath. So that itself also take like additional training and communication among clinicians as well. Because in all the school, even when I went to chiropractic school, we talk about psychotherapy or psychology is part of our course. But again, how to do the referral out is not really, it's not clear cut for us either, right? When we were in school. And for some others, do they feel confident referring to a nutritionist or acupuncturist? For example, someone who often has anxiety. All right, I was talking to one of the therapists before. Would you feel comfortable to refer your patient to acupuncturist? And first thing she would say, no, not really. I would ask why, because if they have anxiety, they most likely will have fear for needles. I say, I guess that could be true. But at the same time, there are a lot of research that support acupuncture can also help anxiety. So how do you judge that, right? Um, how are you going to decide, well, should I refer my patients to acupuncturist or should I not? So part of it is really based on the patient experience and your experience too. So that's why in our clinic, we always stress again the weekly clinician meetings. And outside of that, we encourage our clinician in our clinic to meet with each other, others and understand what each others can do, how they can help each others. So here's what we look at early on, how to suggest other services, right? As a whether you're a psychotherapist, physiotherapist, or chiropractor, or naturopath, is really understand that, for example, someone has anxiety, we can relate that to someone who has a chronic anxiety, most likely to have a digestive issues. And if that is true for that client of yours, that can be a way for you to refer that patient to a naturopath that you know to help to deal with the digestive issues. And we all know that the um, the gut-brain connections, if someone has a poor digestive issue, it's going to affect the neurotransmitter being produced, and that's going to negatively affect the person's mood, right? So now it's going to have a vicious cycle with that. And that's why understanding your clients, if not just simply for mental health aspect, and we look at what are some of the other physical symptoms other than mental symptoms, right? We can use those as a window of opportunity to refer that patient to, say, a naturopath if they have digestive issues, or a naturopath and acupuncturist if they have sleeping issues, because we know all that problems from sleep issues, digestive problem, long-term digestive problem will feed back to the mood or psychological being of their patients. Now, one thing is also really important is that when we refer out to patients, patients sometimes may perceive those treatment, is that a replacement to what I'm already doing? Right, so it's always got to be very clear to them that it is a complementary, a complement to what you're doing as a psychotherapist versus a replacement. Because all the research right now is we're looking at when someone's going through psychotherapy, and if they have a good nutrition or going on certain supplements to support the biochemical in the body, the neurotransmitter in the body, it will help to get better result. And same thing for acupuncture as well, right? So that's why those are really important. And when we start to understand the brain guts connections, such as that 90% of the body serotonin is really produced in the gut. So when our gut's not working well, it's obviously going to affect our hormones, our happy hormones with that, right? So that's why we look at your personal belief really shape our clinical decisions, right? What your own experience is like with acupuncture, naturopath, nutritionist, and what the patient's experience is like. So for the example that I was talking to one of my therapists, when I talk about acupuncture for anxiety, she immediately said, you know what? No, that's probably not a good idea because all the anxiety patients of hers may feel anxious already, may not want to do acupuncture. And that could be true, but also based on their own experience. Because I think for her own experience, for acupuncture, it gives her nervousness. But that's not necessarily true for everybody, right? So when we do so now, I also give an example that I know other psychotherapists have their own clinic, have already implement or include naturopath in the clinics, and some other includes acupuncture in the clinic. One of the psychotherapists that worked with me a long time ago, she started a clinic and which included acupuncturists and which worked really well in her practice. So that's why your own belief system really kind of drive how well you can make that integrative practice work for you. Okay. Um, and I know there's also another clinic in Brampton where it is primarily a psychotherapy and psychology's clinic, and they've also included naturopathy in the practice. So how they integrate that is that for every patient that they have do intake, they'll offer them a 15-minute consultations with a naturopath, right? It's just part of the protocol for every patient that come in. And the way they explain it is that the nutrition is a very important part of your recovery process. So that's why they want them to go through a 15-minute consultation with a naturopath to identify are there any needs in the nutritional intake aspect of it that can help with the recovery process as they go through the psychological and psychotherapy sessions at that one particular clinic. So that's why your personal experience really and with different type of clinic will have their own favor how they approach the integrative approach, if that makes sense. Now, others, and for those of you who hasn't really read much and look into integrative practice of including acupunctures or naturopath, how to, why to integrate that. I mean, there are a lot of research out there right now, and some of them are more recent research to 2023, 2024. You can find some of this research as well, is that how nutritions, even some of them are including double-blind study and randomized study that dietary support alongside psychotherapy. In this case, they utilize Mediterranean diet. Okay, really shows significant greater improvement in depression's patients. Okay, and 1/3 of participants in the diet group achieved remissions compared to 8% of the control group. So there's definitely not a lack of study talk about that. It's really a matter of whether you feel comfortable um, bringing that up to patients. And when you bring it to patients, one of the challenge that I talked to a friend of mine who has a pretty large psychotherapy practice in Toronto, and in talking to her about how what the challenge that she finds in terms of recommending her clients to other disciplines that is time. It's not just and is you got a 15-minute counseling with the patient and trying to include some of the research information to convince the patients, she found that it's really hard to do because there's sometimes, 15 minutes or an hour is barely enough time to go through their own sessions for the patients. But when we really understand the research behind it, it actually makes the sessions much easier in terms of helping the patient say, hey, here's the here's what I can here's what I can do for you in terms of psychotherapy, but here's the nutrition aspect that's going to add on to the result of that. Now, I see that a lot in my own practice because when I deal with concussion therapy, in concussion therapy, it's really perfect integration of a bit of everything. In concussion therapy, we deal with the physical elements of the patients. We deal with nutrition component for the patients, and we also kind of look at the mental aspect for the patient as well. So we kind of dab on a bit of everything and talk to the patient about that. So what I find is that my experience in doing a concussion therapy for patients is that in you only just need about 3 to 4 minutes on each visit to really have the patient understand that right now, as they go through, say, for example, the mental psychotherapy aspect, that is one avenue and one component of their whole entire pictures. And the nutrition component to it really helps the body, the biochemistry to be in a more happier mood a little bit easier, right? So that's why the nutrition aspect, whether you look at omega-3, probiotics, a lot of different specific supplements also help to proven that for patients, we can tailor to their needs, and that will improve their outcomes, whether it's depression or anxiety. Now, the other one is also emerged research is on acupuncture. So for acupuncture, there's a little bit different between whether you're applying an MSK acupuncture, meaning for pain only, or if you're actually using a TCM, traditional Chinese medicine. The acupuncture aspect, it only kind of works if the person is applying traditional Chinese medicines um, approach protocol for the patients, and so that it can help them with addictions, depression, anxiety, or even the PTSD. Okay, those are kind of, so when you meet with an acupuncturist, we will have to really understanding how they approach the patient. They approach primarily from MSK, or do they have training in traditional Chinese medicine, utilizing those skill sets to help the patients with the mental health aspect? So one of our naturopath that works in our clinic, and Dr. Lee, interesting is that she comes from a background of counseling therapy prior to becoming a naturopath. So now that she is a naturopath, and when she learns the TCM, she actually paid a particular attention and learning, understanding how the TCM methods in acupuncture can help with mental health. So, so she actually taught me that we had a discussion a few days ago. She actually taught me that having when they doing acupunctures on the patient, having the intentions for their mental health, such as depression, anxiety, they will apply different points than just they will utilize different acupuncture points. So that's why when you do meet with acupuncturists, you want to find out for their background, are they using TCM methods, or do they also have a intentions or um, a specialty or special interest in applying acupuncture for mental health? That's actually a really important aspect, because not all acupuncturists would do the same thing, and they're not going to have the same focus as well. So here's just another example of some of the more recent research that how acupuncturists can help with, for example, the anxiety and depressions, and it actually can be quite effective. So for mental health aspects, really, there's really no questions of whether integrative practice, including acupuncture, refer the patient out for acupuncture, nutrition, whether that's going to work or not. Um, the research is definitely there. I think the main challenge is how can we make it easy for us in clinic setting and recommend that to patients, given that little time that we may have for with our patients, that time that we have with patients. So even though the research are there, why is it that collaboration is not happening more? As we mentioned, that some of my colleagues, they mentioned that lack of time is one of the major reason, um, and sometimes lack of opportunity to connect with others, clinicians for acupuncture or naturopath. And part of it is also lack of training of how to refer, how to ask the patients, and how can I uh, for lack of better words, convince the patients or point out to patient that the acupuncture or nutrition is a integral part of the healing journey, and that can actually help them to get better faster. And lack of referral network, or sometimes maybe even fears of losing patients because they think that, or the patient may think that, oh, maybe I only can do this if I'm doing the acupunctures, or if I'm doing nutrition. Maybe I do need to see a psychotherapist, whatever the patient they have in mind, or sometimes could be simply lack of funding for the patients to do that too. And lastly, is also fear of knowing how and who to refer as well. So the simple step that you can really start it today, if you want to do more integrative practice, is really start introduce yourself to local acupuncturists, naturopath, or nutritionist. And good thing with naturopath now, a lot of them also doing a virtual practice for nutritional consultations. So that can may also help to break the barrier of finding someone locally necessarily. All right. And when you do meet with them, it's not just once or twice, really kind of ongoing, meeting that person, explaining what you can do, how you can help them, and not just what you can do, not getting about getting referral for yourself, but really how you can actually help the existing patients. Okay. Or asking them how they can help your existing patient also, really. And sometimes it could be workshop for patients. Um, if you work in a clinic that has multiple psychotherapists, then you have more patient base, then you can hold up a workshops for patients to come. Just like we're having a workshop for psychotherapists primarily, you can have a workshops just for the patients to come and invite other clinicians such as nutritionists, naturopath, or acupuncturists to explain from their angle how that can be effective, um, additional therapy for those clients of yours, right? So it's really aimed to help to refer your patient out for co-management purpose. So in our clinic, we have a Dr. Lee, yeah, the one that I mentioned earlier on, has a background in counseling, is very lucky, and that she does virtual treatment. So when we have the patients, because I learned that about her, so when I speak with my patients, uh, who has um, not only nutrition related issues, but also talk to me a little bit about some of their mental challenges, then it's easier for me to refer that to Dr. Lee as one of the naturopath as opposed to another second naturopath that we have. And if those person who needs requires more in person, then Dr. will also refer to Paul, our acupuncturist, and using a TCM methods to help them whether with anxiety or depression as well, in addition to nutrition. So each person, I think that each person, each clinic will have different collaboration stories. Depends on who you're able to network with and who is in your community too. But probably one of the biggest hurdles is really actually going out and meeting the right clinicians in your neighborhood that can work with you, and someone that has a focus interest, special interest and focus in mental health, just like you do. So I think that's really one of the biggest hurdle. And for patients now, I find that for a lot of patients that I come across with in our practice is that a lot of them are very open um, to having more than one clinicians helping their issues. Meaning that other in addition to psychotherapy, they're also very open to what else can I do for myself? Can I eat something? Can I help myself with nutrition to help myself? They're also very open to that from my experience at working with my patients over the last several years. So I don't know if there are any questions, comments.
We have two questions in the
Yeah.
chat. Would you like me to read them out?
Yeah, because do I see the chat? Because I don't think I see the chat.
Okay, the first question
Oh,
is
yeah, you know what's over here?
okay. It's about one of the hardest things. So Barbara says one of the hardest things for me in private practice is time, and then finding other practitioners who are willing to offer their time for the meet and greet. Suggestions on how to manage this demand.
Yeah, yeah. Go ahead. Yes. So the question, my understanding is that being a busy, running a busy practice, how do you find time to meet with other clinicians? And when other clinicians also have a hard time to find time to meet with other psychotherapists. Is that right?
Mhm. And she's
And
also mentioned that you've been addressing it and throughout the presentation, but if there's any specific, I guess if you have any specific comment on that.
yeah, and that's one of the challenging things, even over years, and learning how to run an integrative practice is really let my clinicians know that in addition to coming in to the clinic within the clinic hours, really when you're in your downtime or make it additional meeting time is to meet other clinicians. If you are actually really interested in the integrative practice, you will have to kind of make time for it. And I think it's one of the best way to maximize your time for it is to have several people together and do a meeting versus one-to-one where just meet one person at a time. Right. So if you're able to, that's why in our clinic, we just do a 1 week, at least weekly, we do a group meetings on Friday afternoon, about 45 minutes, half an hour to 45 minutes. And we're 45 different clinicians that we join together at the same time. So having different clinicians meet up together, that's probably the best way to maximize your time if you are very busy, throughout the week, right? With your clinic hours. And that's pretty much the way I find so far is to do that. And that's to be honest, I used to do it individually. And like Barbara said, it's just like, what, I don't have time for that anymore to do each person. So when I start doing it in a group setting, not only save me time, but also find it works a lot better because in a situation like that, then the clinicians start talking among themselves. Okay, I became the facilitator to kind of facilitate some of the questions they may have, or the direction of the conversations. But then actually, I find that we get better results, and people understand what each discipline do a lot better.
And I guess also just learning from the shared wisdom of the group in some ways.
It really is. So for example, let's say if you have uh, a group practice with only psychotherapists, right? And hopefully that you're going to have, let's say, monthly meeting with all other psychotherapists together. So you can invite, just like tonight, invite other clinicians in your neighborhood that you're interested in, connect with, partner up with, and come and do a talk with you guys. And and the talk should not be just simply what they do, but it's really kind of educating and understanding challenges within your practice. What are challenges your practice? How to refer it out? What do patients say? For example, give example that well, I talked to a therapist where they did not know how to recommend their patients to see a nutritionist or naturopath. They find that it's so out of the scope of practice. How do I even bring it up? Right. So if your patient often have anxiety and depressed, oftentimes they're gonna have digestive issues. Very oftentimes. It's just a matter of us learning how to ask those right questions. Right. If you don't learn how to, so once we learn how to ask the right question, it becomes much easier. And and same thing in my own practice. Like as a chiropractor, how do I, make the recommendation for my patients to see a naturopath or to see a psychotherapist? Really asking the right questions. So the question is no longer about pain, right? The person is really the question is really all about how that affect your general life, your lifestyle. How does it impact your what is it that you want to do, right? How does that make you feel? Okay, they may say I feel depressed. I feel anxious when I'm around my family. I feel that those are opportunity for me to suggest that hey, have you speak with someone about that, especially a condition that can be in chronic pain. In chronic pain setting, it's not something that we can help them with to get rid of the pain 2 or 3 visit. Most likely they have that pain for 6 months or longer now, right? So now they're going to have other psychological symptoms associated with it, whether anxiety, depressions, lack of confidence, various different things associated with chronic pain. So that's the opportunity we can ask them the right questions and refer them to the right clinician to help out.
Thank you for that. We have three more questions actually. I'll start with Sarah's question. Um, so they say that they're a student art therapist, and they found this webinar really educational and inspirational to understand what the scope of practice can look like, not being limited and creating more of an integrative care. Their question is how to approach incorporating integrative practice in private practice versus non private practice, especially as a student. They say they might not have private practice right away after graduating, and there will be a lot of red tape to navigate when working with an agency, for example. The question is around integrative treatment plans in private practice versus non private practice. Set.
Okay, so to answer the first question, in private practice, how to integrate into how to do a integrative practice in a private practice. If you are a student and just starting out, is assuming that you may not have a lot of clients yet, so you really utilize that time to meet a lot of different different clinicians, and not just other psychotherapists or other psychologists. Really meet with a lot of others disciplines, make connection, network that way. Whether it's acupuncturist, nutritionist, or naturopath, really make as many connections as you can, and as you speak with them, not just really talk about what you do only. Actually, first of all, don't talk about just what you do. Okay, it's really to find out have a real genuine interest about what they do. It may seemingly, well, what does this got to do with my practice, in psychotherapy, trying to talk to acupuncturists, but as you speak with them in a genuine in a genuine interest what they do, they're going to ask about what you do eventually. And then you ask them the right question and teach them how to ask the right question to their patients, um, about the mental health aspect. Okay. And then they're going to learn how to refer to you and vice versa. Right? Because then you also get to learn what question you can ask to your patients so that you can suggest that they can see someone else, a nutritionist, and or naturopath. Because how effective you are able to refer your patients to someone else is based on, are you asking the right questions? Right? If you simply ask them, oh, you work on their anxiety, depressions, and then all of a sudden you say, well, maybe you can also see an acupuncturist. Some patients don't understand that. They cannot connect the dot together. And you think it was like, are you trying to say that I should see an acupuncturist instead? Of course, that's not what he's suggesting. So it's really learning, asking the right questions for your patients to help them along with the integration of that. Now, if you are in a non-private practice, I guess it has to do with what setting you're in. Are you in a government setting, working, for the government, if you are working in the government, I think that you doing your best in your ability within your scope of practice, looking out the best interests of your patients, and yet you have evidence based study to support your recommendations, um, then I think you are doing your job, because you are not recommending that person to try a omega-3, or you're not recommending a person maybe take some more probiotics. You are simply seeing the needs of the patient, that, hey, you got a lot of anxiety, it's affecting your digestive system. You're telling me that you're going to populate once a week. Obviously, that cannot be good. That is outside of my scope of practice, but maybe you should also see a naturopath regarding that. But you can draw them a understanding that when your gut is not doing well, most likely it's going to affect the neurochemical in your body that's mostly produced in your gut, and that can also have a feedback affecting your mood as well. So when you have the scientific study evidence to support your recommendations, and I think you should be cool with that. I'm not sure what the college would say.
Thanks for that, Dr. Fung. There was another question from Barbara, where she says, if you work with a practitioner outside of your practice, do you share formal documentation in terms of diagnosis and explicit treatment plan?
Oh, wow, that's a great question. I think if you want to do that, you definitely need the consent of the patient. That's really the most important thing. You need consent of the patient. Say, I'm going to refer you to, say, a naturopath that I know. And do you mind me to share our plan with that naturopath? I think that's number one, is that making sure that you have the consent from the patient to do that. No difference from uh, when insurance or other agency asking for our clinical notes or anybody clinical notes, they need consent of the patient, right, in order for them to do that. So if you were to make that proactive approach, which is great, but make sure that you have the patient consent and patient knows that you're going to do that.
Wonderful. And I think there was another question from Barbara where it was about what helps us avoid falling into our own silos of care after we make a referral. What kind of buy-in do we need from practitioners, and what does it actually require from us?
Can you repeat that again? I'm not sure if I fully understand that.
Sure. The question says, what helps us avoid falling into our own silos of care after we make a referral? And what kind of buy-in do we need from practitioners? And what does it require from us,
So what kind of buy-in do you mean, like buy-in from
the
um,
practitioner that we're making?
other practitioners, like other psychotherapists in your own practice,
No,
or
I
other
think
disciplines?
I think other disciplines. Correct me if I'm wrong, in that.
Yeah, I'm really, I think I make a number of referrals and then the integrative care stops there, and I really want to think consciously about, if I make a referral, or if I want to actively work with another practitioner of another discipline, what am I asking from them, and how do I stay the course to make sure that the care is running together, rather
Okay.
than I just make the referral and they see
Okay.
that person and they see me, but how do we work together
Okay. I
effectively?
see. All right. I see what you're saying. So, Barbara, in that case, are you seeing that patient at the same time?
Correct. Yeah, for
Okay. All
sure.
right.
We're
So,
both we're both working with them. I've said,
okay.
hey, I think you should see a naturopath. Go
Yeah.
see Dr. Lee. And
Mhm.
but I want to make sure that Dr. Lee and I continue to have some kind of conversation, so the care,
Yeah.
like I want their care to dovetail into mine, and I want mine to be in line with theirs, and I don't want it just to be like two separate
No, no, absolutely.
clinicians.
So in that case, when you choose the clinician that you choose to refer to, make sure that when you establish that relationship, they have a clear understanding. Hey, when you refer patient to each other's, um, you like to, especially when there's a co-management happening at the same time, make sure it's clear that set a times that hey, maybe we talk once a week, once every 2 weeks, or once a month, really briefly over the phone for 5 minutes or something. Okay, make sure there's a clear understanding from the other clinicians,
I
as
think
opposed
that
to, sorry?
Sorry. I think that's an incredible idea, actually. Like if I were to make the referral, I've never done this. I've been in private practice for a long time.
Yeah,
But if I make a referral to a clinician directly and I reach out to them, I say, hey, I want us to work together. Here's the consent I have from the client. And would you be open? Like, I can see myself making that ask. Would you be open to checking in a month, and then again in a couple of months, and just to ensure that we are staying on board with the treatment and the progress that we are each seeing with this particular person.
yeah, no,
And
that
I
like
think if I did that up front, I'd have the other person might be able to be like, yeah, totally, let's book them in now.
exactly. Yeah, you gotta do it upfront. Especially if someone that you kind of just met either through networking or through someone, introduction, whatever the case is, right? If you don't know the person really well, you gotta say it upfront. All right. So for like in our clinic, obviously a little bit easier because I tend to see all the clinicians on regular basis at least once a week. And if not being OCD that I am, I'll probably give them a call myself. But at the same time, when other clinicians send me a patient, whether for scoliosis or concussions, and oftentimes it's a co-management, all right? So for myself, I know that if I want to keep maintaining that referral relationship from other clinicians and typically from other chiropractors, and after I see them for the first time, I tend to give them a call back and say, hey, thanks for referring so and so. This is what happened. Okay, so I know that I tend to do that. Uh, I cannot say that for all the other clinicians, but same thing for you, right? If you were to receive a referral from, let's say, a naturopath or acupuncturist, and to help that patient additionally for the mental health aspect, then it also be a good idea for you to send that patients and send the referring doctors or practitioners a note, an email, or phone call. Hey, thanks for referring. This is what we plan on doing in person, helping with the patients. Um, and since we are co-management, why don't we catch up in about a month or two or so?
Thank you very
Right.
much.
And one more thing
Yeah.
that's really good is that I think when patient come to our clinic, one thing I ask them, well, why do you come to choose us? And often I hear is that because you guys get everything one-stop shop, which tells me is that not simply for convenience, for physical convenience purpose, it's really that patients want a place where they want the clinician talk to each other already, right? Because they kind of almost assume, even though we still need to get the consent from the patient, but they kind of really go to those kind of one-stop shop clinic place, hoping, expecting those clinicians would talk to each other. So save them time and work. And that's what really patient, why they choose to go to clinic. They enjoy going to clinic where it's kind of one-stop shop for that one, definitely one of the reasons. So when you have that, and at the same time, if you know this person has a naturopath that they see on a regular basis and they come see you separately, right? Not referred by naturopath, you can simply ask the patient, hey, I see that you go see a naturopath too, right? And I think that's great synergy for us as psychotherapists, helping you mental health, but also working with your naturopath as well. Do you mind me reach out to your naturopath or not? If they do, then you don't, right? Some people are very private about their mental health. They don't even tell anyone else. And if they don't mind, then great. There's opportunity for you to reach out their naturopath and speak with them about it. And that potentially, hopefully, there will be a source of referral for you too in the future.
Yeah, I'm going to jump in really quickly with one, but I appreciate you having this conversation really, because I think we need to be conscious and purposeful about how we build those relationships and who we refer to. And like our clinic, Redbird, is all only psychotherapists. So if somebody comes here, um, then they're just going to get a psychotherapist.
Hmm.
But as a clinic, for our clinic, we actually have formal partnerships and we put them on our website. So there are other clinicians that we know, that we've kind of vetted, that we've built relationships, or even lawyers, right? You know, family law
Yes.
lawyers, mediators, where we're like, I can confidently say, go here and you're going to get some really good care.
Yeah.
And so I'm thinking like in a model like yours where you have everybody on site, it's like there is such an incredible synergy and ease for the client. But in our environment where that doesn't come naturally, we actually have to build it. And I think making it formal, like you know, formalizing it, like we have a partnership page on our website, for example, then that keeps us in connection with those people. Right? So I think it's like, oh, depending on where I am situated, we might need to think about how do we create that sense of we have a circle of care for you
Yeah.
as a client.
Yes. Yeah, I like that term, the circle of care for the client. I like that term.
Awesome. Do we have any other questions? Feel free to either raise your hand or just unmute or put it in the chat. And I think we'll have time for another one or two questions. Is that okay, Dr. Fung?
Yeah, that's fine with me. Thank you so much.
Okay.
Yeah, I think I'm going to kind of comment on something that if you do decide to have to build a integrative practice, whether you have people in your own practice or have a network of people that working with you, whether on same physical location or not, it doesn't really matters. And and you do have to put in the extra time in, at least initially, to build that relationship and find the right people. Once you do, then it becomes a little bit easier. Actually, it become a lot easier because all the initial time that you have to spend is really finding the right person to build your team of people, whether same location or network of circle of care in your network of referrals, right? And afterward, then it's really kind of ongoing care for your patients that you may choose to email or talk to the other naturopath or other clinicians once a month. And once you also understand certain clinician, like for example acupuncturists, they may have a typical protocol of 6 visits. Then you kind of already know that when you refer so and so to see, let's say our acupuncturist Paul, usually you can expect them for 6 visits. And at the same time, you can help them to adhere to that treatment plan by going to that once a week. And then I also speak with my psychotherapist sometimes when I'm dealing with motor vehicle accident patients or concussion patients and say, hey, are there anything that homework that you want that you're asking your clients to do, that I can help to support that, right? Because often I find that I would see the patients more frequently than the therapist would. So this way, I can also help to support some of the other home exercises strategy that was being implemented already. Because otherwise, the patient may feel overwhelmed, right? Oh, I'm seeing my therapist. They give me like almost 10, 15 minutes things to do. And I'm seeing my physiotherapist also giving me like 10, 20 minutes exercise to do now. Now I have to do like an hour a day. Okay, so sometimes patients may feel also overwhelmed from different therapists give them different suggestions too. So having that overlap and supporting each other, I find that patients do feel more at ease and they feel less overwhelmed and they also feel more understanding. They be understood that, okay, now you understand what I have to do. Thank you so much.
That's a really interesting and important point, and something I hadn't considered until this point. So thank you for naming that. I'm really aware of time, so I just wanted to take a quick moment to thank everyone for showing up on a weekday evening. Thanks to all our participants, and also a big thank you again to Dr. Fung for your sharing and knowledge. I think it was a really, really, I guess, informative webinar, and just got, I think personally for me, got my, the wheels in my head turning about how can we make this happen and what's the process going to look like, and um, just starting to think a bit more about what this integrative work can actually look like in private practice. So thank you so much for that. Just a couple of quick announcements for folks about some of the upcoming offerings that we have at Redbird. We have an upcoming free of cost pet loss sharing circle on Thursday, July 31st at 7:30 p.m. I'll be sharing the links to all of the things in the chat in a quick second. We also have the registrations are actually now open for our Kutana Wema Travel with Purpose program that's scheduled for March 2026. And we are also very, very excited to be launching our South Asian services team. And as a part of that initiative, we will be hosting a series of workshops in the fall. So more information about that will be announced very soon over the summer, but I'm just going to pop all of this information in the chat for everyone to access. Just give me a quick second. And if anyone has any closing comments or questions, feel free to go ahead. Great. All the links should be in the chat, and feel free to reach out to any of us at Redbird if you have any questions about any of that.
Thanks so much. See you next time.
Thank
Okay.
you. Take care. Good night, folks.
Thank you.
Thank you.
Good night. Thank you.
All right. Thank you so much.